Welcome to Sports Doc Talk. Do not worry, I am real. This is not AI. At least I hope. Maybe I don't know.
Never know.
Yeah. I didn't know if we should do the Terminator music, but I was worried about copyright issues going into this AI discussion. Anyway, I digress as I usually do. Dr. Garcia, welcome to the show. Uh, he's our orthopedic surgeon and sports medicine specialist. Before we get started, once again, sorry to do this to you. You're named top doctor once again. Congratulations. I mean, you have a lot of accolades. You put in a lot of work. You travel. You do your thing. This is not a show about, pumping you up. And I didn't tell you about this beforehand, but I want our listeners to know that you're constantly getting recognized, not only in your state, but nationwide, how talented you are. So I just want to say congratulations before we get into real conversation here.
Well, I definitely blindsided by this, but I appreciate it. Thank you so much. Yeah, no, it's a really nice honor, and yeah, we take good care of patients, and this stuff's the fun part. We get to talk about the random stuff and chill podcast mode. I get to wear my hat. About to go in the sun after this, right? I get
Nice.
my relaxed casual. So this is the fun part for me. And then in the office, we make sure we take care of the serious issues. But no, yeah, appreciate it. No, it's been fun.
All right, let's give a quick shout out to our friends at the Recovery Shop. Dr. Garcia, take it away and just let everybody know why the Recovery Shop is number one on your list when it comes to recovery.
I mean, I think the biggest thing for me is a busy day. You're scheduling patients for surgery. You're trying to make sure everybody's on time, give them their time, and then the patient gets through the whole surgical conversation about the schedule for surgery, and they're like, "What else can I do? Right? How do I make my thing better?" So this allows me to say, "Hey, listen, I trust this recovery shop I work with a lot. We've handpicked some things from there, and so the patients afterwards can sort of have a potpourri or a sort of catalog of what they want to get after surgery of things that I would recommend." Anywhere from recovery, the nice machine, to nutrition. We've talked about this with two of the least the players on there, and many other different things. And if there's something that they want, we can get it for them, which is really nice. So it's all kind of one-stop shop. It's great for the patients. Patients have loved it. Had a lot of good reviews. And for the doctors, you really should be doing this or having something like this for your patients because the patients are going to ask for more. And so to be able to give this to them, it makes them feel, and a lot of it's data driven, that you can get people back with better outcomes as well. So it's been great. So contact Mike B. He's awesome.
Mike B.
And yeah, and maybe there'll be AI for that soon too. Who knows?
Who knows? Let's kind of get into that. And we're utilizing AI. And what's amazing is that we've only had access to AI as far as common folk for a very short time, and it is booming in every aspect of our lives. I do events. I do a bunch of different types of events, in person, hybrids, things like that. I do a lot of work for Microsoft. Constantly using AIs, constantly being part of conversations with AIs, senior leadership teams talking about AI. I utilize it in my everyday life. This boom of AI that's happening across the world. How are you seeing that affect not only your everyday, but at work as well?
I mean, it's not only from when I get home and open the news to talk about AI, but obviously Chat GPT everybody knows about, and now everything's gradient. Like the idea is that Chat GPT in the next few years will be the new Google search terms,
Mhm.
right? So no one's using it anymore. My wife basically uses Chat GPT on her phone to figure out if she has questions rather than Googling it, right? It's Chat GPT in it. So it's here to stay, and it's moving its way. I think the biggest thing for me is the goal is here is to make our jobs easier. I think the concern, and we can jump to this in a second, is for patients is that is it a takeover, right? Like, is this artificial intelligence from the movies where all of a sudden you have robots doing everything for you and you never really see a human, right? There are certain aspects that there may be that case, but there's certain aspects where really it's going to enhance the care that you're getting. And that's what we're here to talk about today, is really help the patients understand from the sports and from the medicine side of things, where is AI? Because I've been seeing way too many articles about this, and they each touch on little tiny topics, and patients are constantly asking me, like, what's the future? Well, this is the future, but
Yeah.
this is a broad future, right? And I think, again, the misnomer is this is version 2.0 of medical care. This
Mhm.
is not a complete flip 180. You're
Not a
not going to come
takeover.
into the office and see, like, you're going to see Dr. Garcia for your knee surgery and you meet a robot, right? Like, that's not what's going to happen. What's going to happen is that you're going to make a phone call, and it's going to be easier to get in touch with somebody. Simple questions may be answered by some sort of artificial intelligence. More detailed questions will get pinged up faster for you, which means that you're going to get, because the workforce can only keep up so much. So now everything is going to be smoother for you. You're not even going to know that it's AI. And then when it's going to happen is when you actually really need to get the in-depth stuff, you're going to meet the provider or the doctor or the
Yep.
nurse or the PA, and your whole experience will be better. Rather than, I mean, how many doctor offices have you called? I mean, I would tell you that my doctor office does a really good job. We do our best to
Yeah.
get things moving along. And we still have delays and people waiting on hold, and they're frustrated. Even in my office, we're very efficient. We're private practice. I mean, my wife's called for appointments 45 minutes, hour for other providers in different hospital systems on hold, waiting to get in touch with somebody, and then delays in calendars and things like that. So that's the whole point. That's what it's going to improve, is improve care for patients, which people, it's hard for them to think about it right now. But let's not get too sidetracked with that. I think really the continued discussion here is that it's going to address everything in all aspects of medicine. And we know this is the future because we don't always talk about investment on this standpoint. But and we could pull up this. Let's pull up this slide first before we get too far into that. So, and to go one more further, we'll just talk about the investment thing first, and then we can pop back over to this perceived barriers. So this is a really good graph, but you can see the billions of dollars that are going into this. So when you have companies like venture capital investing in healthcare startups in AI, and this is like where they're all going, right? Like they're like, this is the next big thing, right? You know that you're onto something. You know this is the future. But it's good for patients to see this, right? Because this is where the money's going. So means that this is where the innovation is going to go. As much as we don't want to talk about money on this doctor's podcast, the money drives innovation, right?
That's
Like
the
none of
reality.
these companies,
Yeah.
it's reality. It's drugs companies too. Like you don't get these amazing new drugs because they're cheap and free. You get these amazing new drugs because there's a lot of financial gain for the pharmaceutical company. It's the same thing with these implant companies. There's a financial gain. We want to make patients better. We want to make them get back faster, but there's also a monetary aspect of this. So it's the same thing. They're in VCs investing in AI startups. So this is here to stay, and this is where the industry is going. I mean, I've gotten calls with financial advisors and talking about, we're really looking at AI as the future, but how can we use it to decrease some of the workforce that we don't need as much and switch over the jobs, not stealing jobs, but now you have AI jobs, right? You're in charge of designing AI programs rather than the AI taking your job. Now, again, I'm not going to go into too much detail with this because obviously I'm not the world's expert on it, but that's what we're seeing. But if you want to go back to that first slide, I think this is really interesting for someone, maybe you for more layman terms can think about this. There's perceived barriers, right, in healthcare. And the one that you don't see is implementation costs. As much as this is going to speed us up, make us better, make us faster, make us stronger, it is not cheap, right? And everybody's trying to make a buck off this. So you have companies. I mean, I literally opened my LinkedIn yesterday and I had 6 AI offers for companies that wanted to AI my revenue, AI my billing, AI this, AI that. And for a small fee, they'll help you implement it, right?
Yeah.
Or you have the people that are the chat GPTs that are not chat GPT, but they're faking it, right? They're charging you for chat GPT on top of it, right? Like everyone's trying to make a buck off this. So they're expensive. I mean, and as much as AI is just computer, you think it's low cost, there is still a cost to it because people are programming this AI. Maybe at some point you won't need to, but there are still people that have to be involved in this, and there's still implementation costs. So that's really important to be aware of. And obviously, like you said, that here you can see the workflow integration. Like, how do you work it in to a doctor's office that has really minimal medical records? Like we have a lot of digital, but some offices are paper. How do you do an AI with a paper office? That's very challenging. You got to start the infrastructure of that. In Seattle, it's less, but there's still plenty of offices that still do paper with some respect to the other.
Especially across the country, depending on the communities and, how old people have been there, because as most of us, you know, we kind of stay formatted what we know best, right? And sometimes we don't proceed with change. Kind of piggybacking on the fact that you're talking about how some offices wouldn't be there, but the big one that when we're looking at the graphic here, privacy and compliance, right? That to me is the big concern, right? That's going beyond AI. Those are the Facebook conversations and data that's being shared, and so that when it comes to concerns, right? Those are the big things. Are there certain things that are happening in offices, or are we still too early as far as making sure that the privacy and compliance doesn't spill when it comes into AI and how information is being shared?
So I think when you think of AI, you think of like, I think the layman person may think like AI, this is a self-thinking learning module that we're going to set up. So you really can't put bars on it, right?
Yeah.
But the thought process is this is still a program. It's still designed, and then it has its own learning capabilities to it. But it really is not only is it learning, but it basically can pull a lot more information from around the world and through the internet than the average program can do. Right? It's just not as clunky. It's like the upgraded computer, but much better. Right? And so the process here is that there is HIPAA compliance. We have HIPAA, which is where
Yep.
we try to protect people's things, but it's hard, right? Like I think the thought is that basically it's not going to be an exput. Like basically the idea is like it can gather information from you. It's not going to like start sending off your data to other people.
Yeah.
But yeah, you're right. I mean, if you design something that can like break through firewalls and it's like, okay, how do I diagnose this patient? Well, the only way this AI knows how to do it is to break into someone's records and take every patient's ever had that diagnosis, look at all their symptoms, and then diagnose your problem. That's concerning. So
Yeah.
you have to have it, but the problem is too, it's also got to be more of a global thought, right? So we're not there yet. But there's certain implementations that are not really needed for HIPAA, right? You're talking about like making a diagnosis without any provider available, without any other records. But
Yep.
there's enough stuff online that like, much as I hate some of the doctor Googlers, you know what I mean? The people who come in and they maybe Dr. Chat GPTers,
Yeah.
you know what I'm talking about?
Yeah. Oh
They
yeah.
diagnose themselves on Chat GPT, and I'm have to explain to myself how that may not be exactly right. Right? Sometimes they're right, and sometimes they're not.
Yeah. Yeah.
But the point being here is that there is some aspect that you can get that innately. Like, you don't need to go into somebody's records and get that information. Like if there's enough data and enough textbooks out there that don't have patient information that most of these programs can learn from. So I don't have much concern about it because I feel like it's very stringent. And unfortunately, the medical field's way more stringent than anything else.
Mm.
So basically, like if I want to do something, like it's got to have gone through multiple checks, right? It's like the pharmaceutical injury. Like you can't just like start putting things out there. Versus there's a lot of other things which we don't talk about now that are industries where there's no bars, there's no checks and balances. I have tons of checks and balances on me. So there's still always room, as we know. If you look at the news, you've seen it before. There's different ways people can be scrupulous, but it's a lot less likely in medical than is other fields.
That leads me right into this question between using AI as a diagnostical tool versus a decision-making tool, right? You're still relying on everything that you've learned, all of your experience, maybe peer to peer. How does that compare, or is that some of the conversations that happened within your office and just your peers?
Yeah, so let's go to that slide on the top clinical uses of AI in 2025. I think that'll be good to go over that one. And then we can kind of ping into the doctors. So yeah, I'd say next slide, because that AI's.
Yep,
So
there you
this
go.
is really good for patients. So when you think of diagnostic tool, it really kind of depends on what you're talking about. So the real use of this has been radiology and medical imaging, right? Can we use AI to help
Why is
find
that? Just to get a
because
better understanding.
because radiologists are very important, but there is a lot more black and white there. Like you're not interpreting that picture. They're looking for something on the image, right? And it's a lot different than like you don't have to listen to the patient, calculate the MRI, calculate physical exam, and then hopefully use your experience. And then sometimes it's the patient's decision, right? You'll like you get a patient that comes in and they have an ACL tear. The program may just say, you just need to fix it, fix it, fix it, fix it, fix it. Like everything says fix it. But the
Yeah,
patient
yeah,
doesn't want that surgery. Right. So how is the AI machine going to back off and say, listen, I got to listen to the patient here?
yeah, yeah.
Versus in radiology, there's no conversation between the patients. They're maybe talking to the doctor occasionally, but all they have is that one thing in front of them, right? And they have data pieces, maybe the patient's diagnosis. So it's a lot easier to put in the data, and then they can look at patterns, right?
Gotcha.
We
Yep.
all use patterns in our brain, but a lot of times my patterns are developed from multiple pieces. It's physical exam, which you can't get from AI until it's
Mhm.
actually been done. Does that make sense?
Yep.
And then there's experience. Then there's also conversation with the patient, hearing what they're saying, because sometimes they don't know. Like they'll give you exam findings that'll be all off, and you got to interpret that plus the MRI plus that. Does that make sense?
Yeah, yeah.
Um, it's just a little bit more complicated in that sense. Not that radiology is not complicated, but it's pattern recognition. They're very, very good at these radiologists. I mean, you can see. Go to the slide before just really quickly and show this. if you can go by there, I just want to show this for them. I mean, that's AI versus for breast cancer, lung nodules, fractures. I mean, it's very similar
Yeah,
with
hand in hand.
some
Yeah.
radiologists.
Yeah.
So it's not like these radiologists are making mistakes and they're finding it. And this is again, this is certain studies, right? If
Yeah.
you look at 1,000 studies, some studies will be positive, some studies will be negative. That's the problem with some of these massive problems that we look at, because you can interpret the data either way. You can interpret this data and say, well, they're all higher in the AI, so AI is better than radiology. But like, what are they diagnosing, right? Are they diagnosing non-cancerous breast cancers? Diagnosing cancerous breast cancers? They're different, right?
Yeah.
If you
Ultrasounds
find,
versus
I mean,
MRIs. Yep.
let's be honest right here, lung nodules. And I look at MRI, I saw 2 MRIs in the last 3 months that have shown a lung nodule, but they're usually benign, right?
Mm.
So now that person's got like extra aggressive findings that the
Yep.
AI machine's like, you have a lung nodule, and now they're freaking out, ends up not being a big deal. So we gotta like, we're not there yet, and we gotta like interpret that like how, when the radiologist sends us the lung nodule thing, they say cannot, not concerning for major cancerous things, but by this criteria, you should look in 6 months and blah 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 blah. But maybe the eye is just gonna be like lung nodule, not good, right? Like you don't know, we don't. There's not
Is
as
there
much emotion.
also a checks and balances, as far as in conjunction, right? So based on your diagnostics and then checking it with AI, so is that tool being utilized in that manner or in a different manner?
I think that's an excellent point. I mean, that's really what AI is for us in medicine. It's a conjunctive tool. Like the expectation is not that you're going to send your images to an AI radiologist. The AI
Mhm.
radiologist is going to scan it, and then they're going to send it back to you, and no one will have checked it. Does that make sense?
Yep.
Because I can tell you right now that I would never want my images done like that.
Yep.
But what is going to happen is, let's say the radiologist, like I had this week, I had a radiology report that was not accurate compared to the MRI, but I checked my own, and it happens. It's the same way someone can check me and they'll say maybe Garcia is not perfect all the time. We're not perfect. But what's going to happen is the radiologist reads the report and then the AI double checks it. And if it finds a discrepancy, it calls the radiologist before they send it to you. So there's less mistakes, right? And so that's really what's going to happen. That's where we're
Mhm.
going. Or for very simple things, let's say you're in a rural place and you get an MRI and you can't get a radiologist. You don't have a contract or something happened, or let's say you find a weird tumor and you're in the middle of somewhere and you don't have a contract with a radiologist that knows that specialty. Well, now you can use AI to be like, okay, this is what I think it is, and it's a lot cheaper, and then you can send
Yep.
it over to the appropriate people. Right? That's where we're going to go with that. Those
Using
interpretations.
it more as a tool than just a straight handover, say, well, you do it. It's in conjunction. And then how does that benefit you, or does it at this juncture, as far as planning for surgical procedures or having conversations? Because I'm assuming that you're having different conversations with different peers, especially when you're group, if it comes to something that needs multiple discussions depending
Yeah.
on the delivery.
All right. So we're going down a rabbit hole. So we'll
That's
talk
what
about
I
this
do.
briefly. And we'll go. No, no, it's great. I love it. But we'll go to this topic and then we'll bounce back, because I think we're
Okay.
going to miss some things that people want to hear about. But
Okay.
the idea is guidance, right? So like, you get a CT scan, which is a scan you guys all know when we look at X-rays, but a lot of them combined, so we can look at bones. And it's really good for guidance of cutting, like bone cutting things, or shoulder replacement surgery. Talked about knee replacements. So basically, now you get the CT scan. You tell, and or the CT scan tells you what you're going to do, right?
Mhm.
And people were like, well, why would you need to be told? Well, sometimes you can't always figure it out, or there's some subtleties. So they can use more experience. Like if you're a new surgeon, then you have AI to help
That's a good
you,
point.
guide you what to do, and then helps with the surgical plan. Because sometimes that's the hardest part. Like when you start doing osteotomies, like I've talked about before, where you correct the knee,
Yeah, yeah.
it's a lot more complicated than it sounds. Like the surgery itself is not like the execution. If someone always told me what the right surgery to do every time was, my job would be a lot easier, right? The whole purpose of coming to my office and getting this special stuff, and me being like, even though I do so many of these, I'm not always 100% sure what the right osteotomy is until I get the final scan. And so for me, and that's like, now I've done this for like 7 years and I've done a ton of these and like super high volume. So it's easier for me because I have the experience. But if you're seeing like one or two of these a year, which is what the common person with a common surgeon sees, like, how are you supposed to have that experience, right? Like, you can't just ping a friend every time you want to do something, and or you may not feel comfortable. I mean, we all know that surgeons they all ask for help, but not all the time, and some they
Mhm.
don't know what they don't know. And so it would be good. It's good to have these programs. That's what these CT programs do, is they kind of, hey, this is where I recommend, this I recommend. But even when you get a CT program now, it's not smart enough to say, hey, listen, surgeon, you're not doing the right surgery for this patient. You need to do this surgery instead.
Mm.
And so that's where headed is those like those tweeners, right? Like the 10%, 20% that's more complicated. That's when it basically gets bumped up to the AI, and the AI starts to help out with guidance here. Or when you're doing like spine surgeries, like it's guiding where your placement is. It says, oh, you're off by 2 millimeters, 2 degrees, move it 2 more degrees so you don't damage a nerve. Right. So that stuff's like, and we're kind of there. We have some guidance, but it's just going to keep getting better, because I think one thing is, like we keep saying in conjunction, it's version 2.0, right? Like I do dictations in my office, and so I do Dragon. You may all know Dragon. It's old. It's been around for a while. So basically, I tell it what I want it to say, and then it spits it out. I can tell you it's not perfect all the time, and despite how fast I talk, it like cannot keep up, even with supposed to be this AI thing. So we're not there yet. So that's the same way with the computer. Like we need a faster. We know, like I was just telling Will, right? We design these backgrounds. It takes like 4 minutes for it, right? Like
Yeah.
you don't want your patient, thankfully for planning purposes, it doesn't matter how long it takes, but you don't want your patient, being like on the table and your doctor's using AI and the AI is stalling out because it tires too much bandwidth, right?
Oh
And
no,
that's not
we're
what you
just gonna
have to
keep
worry
that knee
about. But
open. We're just gonna keep that knee open as we try to figure all this out. Are these the
yeah,
conversations you're having with your peers? Like, what's the most interesting? And I apologize, I'm kind of going sidetrack. What's the most interesting conversation you've had regarding AI with a peer or peers lately?
I think it's like, for me, it's like for what I could use AI for is like the complicated surgeries, right? Like, how's it going to plan it for me? Or also for me is like, this is the one thing I think AI is really important for, is like, how can I do all the things that I don't want to spend my time doing? Like
Mm,
website design. I mean, this sounds bad because it's like, we're not talking about the crazy cool stuff, but
yeah.
like AI has literally freed me up. I mean, everyone that says like you do too much stuff, like your website, you have your videos, you have your podcast, you do surgeries, but like I have to do all this stuff myself, right? So now I can like have my website designed with my company and then spit out a lot of information with AI and then check it and then send it up. Or like when we're designing this podcast, right? We've had AI help us design this podcast because there's absolutely no way we could do this much research. The amount of research that we were able to get from the AI could
Mhm.
take literally like 25 hours, 30 hours, right? Like we're able to get a lot better content to patients. And then when we review it, I'm like, okay, that doesn't seem right. That's not accurate. That's not accurate. That's definitely what I was thinking. And then like even making the images, right? Like this image before would have been a copyright infringement, trying to find the right image, right? So it saves us hours of time. So now what I do is, instead of stressing about the small things, I only focus on like doing a good job on surgery, talking to patients,
Yeah.
making sure that we do a podcast that's got a ton of content in it, and we're able to focus on that rather than being like, I'm just gassed, man. We spent 20 hours getting this ready. I'm done. Like I can't even talk about it right now. Like it's just all my brain is totally scattered. Even like designing projects or research papers or things like that, it helps with guidance. I think of it as like if you get writer's block or something, and it's like, now you don't need to worry about that. Like your skeleton's made, and then you can design it. And obviously, that's a concern with some of these companies, right? Like, is someone going to have a whole PowerPoint made by AI? But it's not there yet. At least maybe I don't know how to do it. Um, but I think the thing is, like, even when you ask it to like, I want this article, make me this article with these citations, it has like no idea what it's doing. So it basically, like, it does a good job and then it starts making up citations. So you got to be careful, right? Like what you tell it to do.
Have you seen anything on your end? And I know you have kind of this is the surgery that we did. This is kind of what I want to see after week one of the surgery, week two, a month, so on and so forth. Are you utilizing AI as with part of the rehab now, or are you incorporating any of that? Or is that something that, or you're just kind of like, hey, this is what I normally do with this process, so I'm sticking
Yeah.
to what I know works best?
I think we're not there yet, but there are so many wearable devices. I mean, I think we're going into the path you want to go, which is great. So I think that AI, we're looking at from a sports standpoint, we're looking at a bunch of things, right?
Yeah.
Wearable devices. So can we collect data on movement, vital signs? I mean, we got AI on my wrist, right? Like, the
Yep.
Apple Watches are all smarter. Apple got its huge AI upgrade recently. Can we detect if someone's, you're sick or you're not feeling well or you're dehydrated or everything else? But then from where it's really the the money's at is the professional level, right? Or athletes, right? Because that's where, we know these contracts are so expensive. And now with the NIL, it's like the college
Yeah.
players and the pre-high school players and everyone else is making a bunch of cash. So, we got to keep them healthy, right? Like the player has the investment, right? Because now it's really nice too, because it's not just the school is looking at your best interest. It's the player. They're like, I want to stay healthy because I've got a $5 million contract. And I'm a
Yeah.
freshman in high school or a freshman in college. So yeah, I mean, we want the wearable devices is huge. And then there's different things like personalized rehab program, right? Like, so, I tell it, you tell the patient, tells it what surgery it had, and then it uses like the best doctors around the country. It somehow finds them and then puts together a PT protocol for you. And then it can make adjustments as needed, right? So that's really good. And like the real-time feedback too, right? Like you're doing something, you're like, this hurts, and the knee, and it can adapt it. Now we're not there yet because again, the problem with all of this stuff is it's super sexy, but in non-professional or college sports, it's very hard to do this because it's expensive,
Yeah.
right? So insurance, and so there's we have rehab machines like we've talked about, the Rebliss and those other things where you can do remote monitoring. Insurance does not pay very much for that. It's a very, very low reimbursement cost. So if you have a machine that's designed, not saying that machine particularly, but if you have a machine and they're like, it's $1,000 for that machine program, right? Or $500 or something, like the insurance will pay like $35. And so like, there's just no way that with insurance that these fancy devices are going to be paid
Yeah.
for, because you need to show that they're a huge difference. And even at that, we all know, I mean, I hate to say, I don't want to go off on insurance companies on this thing, but like, look at the news. Less care is more for them. So
Yeah.
why would they pay for something that's not going to be hugely beneficial unless there's a huge uproar? But rehab is like, is amazing and it's so important for our patients, but I feel like it's really neglected. It's very neglected by the insurance companies.
Yeah.
This personalized idea, like that's not the way we're going with insurance, and so there may be an uproar. But patients are willing to pay for it on their own, which I think is reasonable, and I think that's unfortunately the way we have to go.
Yeah, it was interesting when we first started talking about the show, and we kind of went back and forth, and I sent you some stuff on the smart insole system, and there's a bunch of companies that are using that, and they talk about injury prevention and subtle movements, symmetries and compensations, and real world data collection. My long-winded version of getting to a point of the more companies that come out with AI tech, whether it's smart insole systems or wearable shorts and shirts. I believe Gabriel Landeskog, which we talked about with the hockey player that had the injury, he was wearing that tech also, so his doctors can monitor him. And hopefully, we get a chance to talk to Dr. Cole, and we can have this conversation again when it comes to smart tech and how that's being utilized for rehab. As companies develop and there's more of them that are hitting the market, hopefully the price drives down and not so much
Yes.
athletes that will have access to this, but mom and pop and Joe and Jill can also now maybe
Yeah.
afford this, and we see an uptick in the rehab and monitoring and what that's going to be like. So to me, that's exciting. What are your thoughts on that excitement level and where AI can advance the future when it comes to rehabbing and it being beneficial to your patients?
Yeah, I mean, I think when we keep that slide originally, implementation costs. So when
Yeah.
implementation costs come down, then it's either affordable for the patients or the doctor's office, or which actually is going to be more important is the rehab office. We already talked about this. So perfect example, Dylan Newcomer, physical therapy for players,
Yeah.
right? They do some insurance and some cash options. So the cash options are obviously the super fancy stuff you saw, and there's just no way insurance would cover that level. And that's okay though, because that's the players usually, and people want to pay for it because they want extra. That's the way that works in the United
Mhm.
States, and that's just the way it is here, unfortunately, or fortunately, whatever you want to
Yeah.
say.
Yeah.
But that when that gets cheaper, then more people want to be involved, and more people are not left out, right? But like healthcare is also really expensive. Like if you don't have insurance,
Yeah.
right, and you just pay per meal, most healthy people
Yep.
actually save money not having healthcare insurance. It's horrible to say that, but
Yeah.
like when
It's
your
true.
premiums are $10,000 a year or $15,000 a year, there's no way a young person's going to spend that much on healthcare unless they have a major accident.
Yeah.
So like these patients, and a lot of them work for high level companies where they're paying very little for their healthcare. So they have extra expenditures they want to put towards other things. I mean, we've seen these nutrition, we've seen these guys that, you know, live forever type of situations, the longevity thing. It's all about that. Well, this AI is going to help people get back better. And this rehab monitoring, the kinematic analysis is the pre, but like, can we reduce, you know, there's a machine learning for these athletes to find out who's higher risk. I mean, I had two patients today and a few this week. The moms came up to me. Obviously, there's a kid in there with an ACL tear, right? And they need surgery. One of them had actually tore the other knee. I did surgery on one and they tore the other one. It's very, very frustrating and sad to see that. And they asked, is there anything we can do? And the answer is, yeah, you can do all these different things. We can try to do it. It can try to reduce it. We know females that are higher risk, but really, like, can we do, you know, can like the high school or, you know, the high school coach have this kinematic analysis at the beginning of the year for every kid, especially girls and females in soccer, and then say, okay, these 3 girls are at higher risk because of their kinematic analysis, and or they're at higher risk of ACL tears. And then from that, say pick those 3 girls and say, hey, listen, you need to work on this, this, and this to try to reduce it. I think we can get it down, but it's just something they have to be continuing to work on.
Yeah, and I think you brought up an important part of it, cost. I mean, you know, we know how high school sports are, and we know certain programs are going to be able to afford certain things, and you have other programs that can barely get cleats for kids. So that plays a big part. So hopefully, as you know, the market gets flooded, and there's more affordable available options for them. You know, any concerns, or have you heard any feedback from patients that talk about, well, I'm concerned about privacy? I personally think it doesn't make any sense to me, since I feel like they have all our information anyway. If you have a computer, you have a smartphone, they have all your stuff anyway. But have you had any of that feedback from patients or peers when it comes to AI and that data information that's being shared?
I haven't. Maybe after this podcast, we will. Now they brought it up.
Sorry.
I haven't. I think. Well, I mean, I think it's good my patients trust me that I'm doing the right stuff and making
Yeah,
sure
yeah,
that if I'm implementing a tool in the office or post-surgical or pre-surgical, that I've vetted it. It's HIPAA compliant.
yeah, yeah.
Um, but I haven't come up. But again, you know, these are the same people that, like, these are generally younger patients. They're on Facebook every day or Instagram, getting all of their data tracked, and all of a sudden, like, they move to, you know, it's like, I think we've all become kind of mute to it. There's certain people that are like, you know, they'll do whatever it takes to not have their data. They want privacy, privacy, privacy.
Yeah.
But to be honest with you, I think we're so inundated with it and so involved in our lives that we kind of just gave up our privacy, which
My
is
my
sad.
dai my daily spam just becomes, you know, delete, report junk, and move on. Like,
I
it's
mean,
like
medical stuff
it's
is
gonna
scary for
numb
people.
people a little
Obviously,
bit.
it's a lot more private than, like, okay, knowing that I like to watch cooking channel videos. But you know, nonetheless, it's, I think people are more open nowadays too, which is good and bad, right? You know, like, how many times I work on this myself. I'm not good at this, but a lot of these people, you know, I see like these high level celebrities are like, I just had a massive surgery. Wish me luck. You know, like,
Yeah, yeah.
I tore like everything in my knee. I'm gonna get surgery. I got, you know, I'm recovering from cancer. Look at me. Right. It's all great. It's awesome. But like, people don't, the privacy thing is kind of gone nowadays. I feel like it's obviously like, if you're these influencers, right, they get hurt and they
Yep.
use it as like the next step to get up to whatever. I don't think it's obviously like a bad thing that they're telling all. I think it's really great that they have the guts to go over there and talk about all their medical conditions and feel really good, because not all of us do that. But I think, or lay out all their laundry and their family and things like that. But at the same point, I don't think it's this different day and age, right? People used to be a lot more conservative. They used to be a lot more quiet about their stuff. I mean, I've seen like 9 surgeons feeds where they're just like, they're literally in bed like about to die, and they're like, look at me, I'm about to get surgery. And it's just interesting. It's totally different than what they used to do.
Yeah, I'm more concerned about the cooking shows. Let's go back to the cooking shows that you're apparently watching, man. What's your
I'm
go-to
not a
cooking
cooking
show
show
here? This is
master.
guys
Oh, you
roasting
know my new
games?
cooking?
Go
I'm gonna do
ahead.
a shout out. This is my new cooking thing. My partner, Dr. Wayne Weil, Seattle
Yes.
Hand Doc, is a TikTok monster for cooking. And he and his wife, he has a cool kitchen setup where he has like the kitchen on the island, so you can put a phone right in front of it. Like,
Yeah,
that's
yeah.
really hard to get. Like, my kitchen doesn't have like that, and like, it's very hard. And he and his wife, Nancy, they do it in fast forward, and they cook, and they have so many followers. It's so funny too because it's linked to his account for orthopedics. So he has like no orthopedics on there. He just eats and makes food, and he is killing it. It is awesome. So we were going to have him on hopefully in the summer or a little bit later to talk about this cooking experience. So that's the only really cooking thing I watch. But I think because I'm friends with him and because I look at it, I think I get other cooking stuff that I'm not interested in. So, I'm a big fitness man. I have like the craziest workouts ever showing up on my stream. And that is like the number one thing. It's crazy travel stuff and the workouts. Exercise. There's no humanly way I could do that. Like I'm going to rip every part of my body apart.
Yeah.
Every once in a while, I get one. I'm like, I'm going to try that one.
Oh man, Dr. Weil, by the way, back surgeon, but TikTok influencer, first and foremost.
Yes,
That's
exactly.
hysterical. That's hysterical. Real quick, I like I said, we kind of go off the sidetrack, man. What's the go-to workout right now? What's the one that you're like, this is my go-to? I'm loving it. I know we talked about this before. You like the HIIT workouts, right? You're a big travel guy. Your itinerary is you should be posting your itinerary. We had this conversation last time. You haven't done it yet.
I
You
know.
gotta throw it
I
up on
know. I'm not ready to crack yet, man.
Let's throw it on sportstalk.com. We're gonna drive all the travelers there, and then by the way, they'll see the shows as well. But what's the workout right now that you're loving?
I mean, I'm all about the HIIT, right? Like high intensity burpees, box jumps, but again, I don't want to get hurt now because I unfortunately have to take care of all those people that are my age doing HIIT and like coming in with like the meniscus tear or the ACL tear or whatever. I mean, the
Mhm.
CrossFit injury rate's like 78%, right?
Wow.
Like CrossFit's great for ortho, not good for the body. Everyone
Or
who does
just
it, they all
young
look
people.
incredible, but it's a scary thing. But I mean, for me, it's just routine. It's just continue to do it day in and day out, and a little bit addicted to it. So obviously, but it's a good thing. It keeps me sane, and hopefully, it keeps me. The thing is, I think we should bring this up. We should have this talk, right? This is like surgery is a little bit like athletics. Like my surgery days are so much like pumping, pulling, pushing
Yeah.
stuff that like a lot the injury rate orthopedics is probably one of the highest of any of the surgeries, right? Like I'm leaning back, cranking my back, turning it sideways, lifting a 250-pound patient, lifting a high level athlete, like 6'7" leg, right? Like I'm doing that during the surgery, right? Like there's assistance, but I'm doing it.
You got to
And when
stay
I was
fit.
injured, it was a nightmare because it's so hard to do. So like I've had to stay fit as possible, right? And you get exhausted. I mean, there's some older surgeons that you can hear them like literally like huffing and puffing during the
Yeah.
procedures. And we're standing the whole time, running around full speed. And also, that's not to mention the stress level of actually taking care of the person under anesthesia and doing the complicated procedure. So most orthopedic surgeons, they make a joke because the orthos are always like gym jocks, right? They're in the gym, they're working out.
Yeah.
Like that's the medicine stereotype of orthopedics. But the part of it is you actually need to be that fit to be able to do the surgeries effectively because it's because of the grind you're doing all the time for the most part. So like
I
I've
love this. This
hopefully
is
been able
great.
to protect it.
You
I
know
know
what?
you
I think we're
sidetracked me with
on
the
to a new
AI.
Spartan race. This is like orthopedic surgeon Spartan race. You jump over the operating table. You do a couple burpees. You jump in. You got
I've
to
actually
flip
been
over,
caught.
split 79.
I've been caught in the operating room once. I fell over because someone had took the sitting stool away from me when I sat down and didn't see it, and my tech grabbed me and caught me. It was the most incredible thing I've ever had. It was weird for like 10 seconds, but then it worked out. It was great.
I'm
But
telling
we
you,
have a good
we're on
time.
to it. This is the new race. We're gonna be on ESPN the Ocho with this new obstacle course. I'm
Right
down.
next to the squirrel in the water, in the little water skis.
That's hysterical. All right, man.
Dude, let's digress back in. So let's go. So we talked a little bit about sports, right? And then for joints, you have these patient-specific instrumentation. So you have patient comes in, they get it, the robotic machine or the machine calculates it and says, this is exactly what you need. Now, obviously, the problem here is that like patient-specific is more expensive. So we need to find a way to get that cost down. Can they 3D print those for the same price as a regular implant? Right. And we'll get there eventually. Robotic surgery. This is This is the number one thing people want to talk about. Robotic surgeries. They're worried that like you get a robot done, it does your surgery. There's no actual surgeon there, right? No. The way it works is, again, there's these rare cases and there's some of the general surgeries that are robotics, and they've heard about remote surgeries for like a good surgeon that does the surgery in like another country, and
Yeah,
then
yeah,
they
I've
do it
seen
for
those.
people
Yep.
with underserved or
Yep.
whatever. That's there, but we're not there yet. But like in joint replacement, there's robots that help guide the surgeon, either newer surgeons, which is you always want to have obviously the highest level of skill when you're doing this, but also helps with alignment and things. There's certain things just hard to calculate on the fly, right? Like you can do everything you want there, but when you get in there, it's never always the same, right? Like as soon as you always say, you ask the mechanic, like, what are you going to do in my car? They're like, well, I think I'm going to do this, 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 but we'll figure it out when we get in there, right? Like there is some things you have to figure out when you're in there and you can't anticipate. That's why our job is what it is. And that's why our job is a little bit stressful because I'll go into, I did 15 or 12 surgeries last week, and 10 of them were exactly what I thought they were going to be. And two threw me a curveball, regardless of preparation. And two of them were the same surgery that I'd done the same week. So you just never know. You got to be prepared. And so this robotic surgery is going to help to hopefully eliminate some of that and take away the stress. But also there's a stress factor, right? Like let's say you're doing a replacement and all of a sudden you start doing it and you're like, this, like you can't, you've had a really rough day, right? You're doing
Mhm.
your best, but you're tired, right? It's the end of the day, your last surgery, and no matter who you are, you're a little gassed, right? So you're trying to get your best to do the surgery right, and you're having trouble calculating. You can't get the exact thing to fit, right? But we're all normal humans, right? And we have to deal with a lot of stress. So the more frustrated you get, the less you start thinking, right? It's not like you're going to have an error during the surgery, but it's going to take you a little longer than it should. So having these robots to be like, listen, I have no emotion. I'm going to calculate this for you. I can't get tired because I'm a robot. So they're going to be like, okay, it's 13.4 degrees. And I'm like, oh, thanks. I don't have to do that math. And
Yeah,
they're
yeah.
like, you know what? This is not working. When I put the two implants in, it feels tighter. And you're like, you're kind of already gassed from the day. And it's like, okay, drop it down 1.25 degrees. Okay, so you can go do that. So that's
Mhm.
what I'm talking about. So like a sensor
Yep.
or these robotic things, where do you
I
put
I totally
it?
get it.
Because yeah, so it can do those things. Like we have monitors with the pictures up there so I can calculate in my head. But this robot will be like, no, move your hand to the right a little bit, move your hand to the left for the really precise part, right? But then of course, if the robot's reaming and something starts bleeding, the robot's not going to know what to do, right? So you do all that. Then the surgeon steps in. So it's an assistant to help him, and also makes your job a lot less stressful, right? If you have it, I do a lot of planning ahead of time for some of my big surgeries because it makes it way less stressful, or it's a lot faster, right? Like
Yeah.
because I don't have to these patient specific instrumentation that I use for my osteotomies. It's cut down like 25 minutes of my surgery. So I put it on there, I throw the pins in, I check it. If it looks good, I'm done. Like it's already been done for me. All the like, okay, check, x-ray check, less radiation, all that's done. And so
Yeah.
now you can get a surgery in half the time, which means less anesthesia. It means less blood loss. Everything's better for the patient,
More surgeon,
right? As
more
long as it's
surgeon.
being used. More, and then for obviously you can do more surgeries and all those other things are important, but the surgeon's also less stress, which makes your whole surgery go
Yeah,
better.
yeah.
I mean, it's a win-win for
I
everybody.
I I I
Obviously
like
the
I
number one
like
thing is
this.
getting costs.
I like this. I could see it in my head. So you kind of put on this, maybe even a helmet or like these meta goggles with a microphone and say, I'm now cutting this part and I'm doing this. And it's talking to you as well. It's like, it's 1.2 millimeters and this is that. And then
Yes.
you're talking through it so everyone in the operating room can hear, but also the AI is hearing and is reminding you of the steps. And then you're having this imaging with the goggles to see what you're viewing and assisting you along the way. I
Yeah,
like
what was that movie with Jennifer Lopez just came? It was like maybe a year old now. The Avatar movie where you were like they were in the machine and the machine synced with you. It's like the Neuralink.
yeah, yeah.
Like that's kind of the future where we're going with this, right? Like you'll come in, like there's a new company that's coming out, has AC. It can guide where you put your ACL tunnels. So it's for complex surgeries
Are we talking
and
5 years,
for
10 years, 2 years? I mean, AI
the
is moving
avatar
so fast.
thing, we're a lot longer away from that. But
No,
like
but I mean something to really
guidance,
kind of like that first prototype saying this is the first one, like this one's been approved, and you're kind of going through it as it
I mean,
advances. Like,
we have something that's similar to it, so we're getting there. again, it's just cost, man. It's super expensive to get this. And then you got to get it FDA approved. And then you got to get surgeons to buy on. And then you need to have these, you have all these hospital systems that are cutting costs, right? They don't want to pay, these spine surgeries are very expensive, right?
Mm.
They're good revenue streams, but they're very expensive. We know this. So these robotic navigation machines, they're extreme, like multiple millions of dollars, right? And so some hospitals don't want to pay for it. So they're like, no, you can't have it. So then the patient doesn't get it. They've got to go find someone that's willing to do it.
Yeah.
For small surgery centers, we have a robot because we have multiple surgeons that do the same thing, but it's all part of a cost negotiation with these companies. So the cost is actually, unfortunately, is the number one hindrance for this. But as we've already seen with technology, right? Like flat screen TVs were thousands of dollars years ago. Now it's like dirt cheap. Like if I have my
So
TV, like
funny you
it
say
breaks,
that.
I'm just gonna buy a new one, right? Like it
Oh
doesn't
my God.
matter. Like they're not very expensive. So
That's
it's just,
hysterical.
but
I
this
remember
is
I
the
had
way
an
it is.
HDMI
Everything's like this.
TV. I had an HDMI TV, weighed 200 pounds. Like it was
Yeah.
ridiculous. And it was the newer one, for the time. And I was just praying that it wouldn't fall over and crush my child because it was so heavy. And now these things are 90 inches and they weigh 6 pounds. It's absolutely unbelievable.
So let's go to I mean, we can talk about the radiology, but let's go to, like, people were asking, you asked me before, like, in my office, how would you notice it? So I think there's different things, right? There's work. So there's bigger hospitals. I don't work in a hospital mostly. I consult
Yep.
for hospitals, but I don't work in the hospital directly. If you come to my practice, it's private practice, very niche. But if you work in a hospital, there's obviously the prioritize of abnormal findings, right? Like you come to the ER, everyone screams that everything hurts, right? Like if you ever been to an ER, and hopefully you haven't, but if you have,
Unfortunately, I
you'll
have.
know that, like, everybody looks like most people look like they have an emergency,
Mm.
right? But not all of them actually have an emergency. So can AI come in there and scan them and say, okay, you're having a heart attack, you're first. Your leg is like, you have like a bruise, you're gonna wait, right? Like your liver's shutting down,
Mhm.
you need to go to the front. Right now, you're hoping the front desk person thinks you're nice and puts you higher on the urgent care
Yeah,
list,
yeah, yeah. Yeah.
right? So that's one thing. And then workflow,
That's
right? Like
huge. That would be huge.
that would be huge. And I'm sure it's
Yeah.
coming the way. Maybe I gave someone some idea, and hopefully I'll get some royalties from
Yeah.
that, but who knows?
Yeah,
So
because you have patients that cry wolf, and then you have other patients that go, "No, I'm fine," and sit down, and they're literally dying. So that's great.
and that's in my office too. I mean, that pops in there. Like, and I have that now because I have a lot of my physician assistants will see my patients first. So they're essentially triaging the situation. But
Yep.
before, when I didn't have that, when I was newer, I'd have three patients and I'd have two patients. One patient, would have nothing wrong with them. It's not their fault. Tons of pain. You couldn't figure anything out. Everything was negative, and they're upset with you because you can't find it, right? That patient would spend, 45 minutes with me, either unfortunately arguing sometimes or telling me I don't know what I'm talking about if I can't find it, right? They've seen 10 doctors and I'm the one that's supposed to figure it out and I can't figure it out. So that happens. Thankfully, it's not that often. But that patient, unfortunately, wasted 45 minutes of resources. And now the next patient who I get to is upset because I'm 45 minutes behind, which they're not seeing. And then they have a bad experience, or two or three will have a bad experience. And now, like, it's more than just that. It's like, or I'm flustered, and maybe the next patient, I've got to reset my mind, right? And I maybe miss
Yeah.
something with the next one. Again, this thankfully doesn't happen that often, but it's something to be aware of. So, like, if you can keep the high functioning situation decrease, it's always about decreasing stress, right? Like every doctor's show, every doctor's channel, there's such high burnout, there's high suicide rates. These are scary things to talk about, but why are they like that? Because they're doing activities they don't need to be doing.
Mm.
They're filling paperwork out. They're the ones prioritizing the patients. What happens if your machine did that for you and they're like, okay, now I've done like literally like 20 hours of work for you. So now your 80-hour work week is 60. Oh, right? Like today, I've got my new workflow where I see patients that really need surgery. I see 20% less patients, just like Denard was talking about,
Yep.
but my patients get more time with me. And so I don't get reviews like I've been waiting. He was late. Today I was a little late in the beginning. I apologize to those patients if you're listening, but for the most part, I stay on time, and every patient has me sit down. And usually the patients are like looking at their clock because they're done talking to me, right? Like, so
Yeah.
that's good. So the goal here is that, like, everybody's getting more of what they want, and the frivolous stuff is gone. And I'm less stressed because I actually normally am full speed ahead on everything I do. And now in the OR, it's more efficient. I'm more efficient with workflow in the office. And with AI, it's going to make it better. Like AI notes, right? Like the notes are great, but like half the time the note just repeats everything you just talked about.
Yeah, yeah,
So
yeah.
like there's AI programs on your watch that I can walk in and it will come out and have a note done for me. And then it will document. And then I can add a little bit of stuff to it and make sure it works. And so like that's amazing. Like, wouldn't it be awesome if your doctor, most doctors said they spend like 75%. Now I'm a surgeon, so it's different. But most doctors said they spend like 70% or something of their time doing paperwork and non-doctor stuff. And
Yeah.
surgeons, we have a lot of time we sit around in the operating room waiting for the next surgery to come. But what happens if we had like robotic cleanup so they could clean the OR faster so that we could all be ready and get all your surgeries done and you're not wasting your time either. And you're not as gassed at the end of the day because you're done at 2 instead of done at 5. Right? There's all these other things that we're not even at the point yet where we're trying to talk about limiting the surgeon or any of the staff members, but makes an experience for the patients. If they like called, they got someone on the phone right away. It was AI. It plugged me into my office visit. And the office visit saw you and were like, hey, not a surgical patient, but we're still going to treat you. You can go see this person. And then so far you've just been AI'd in, but you've gotten this all done. I can tell you right now, if you polled all the patients and I said, if you like most time now in Seattle, unfortunately, and Will, you may or may not know this, if you want to have a provider outside of like an orthopedic surgeon at one of the pro alliances, you're going to wait like 6 months to see a doctor,
Mm.
unless it's an emergency, right? So
Yeah.
it's like 5 6 months. But what if I told you you could see someone in like you could pick up the phone, call them, it would take you 2 minutes, you'd be hooked up, you could see someone, you could maybe even talk to an AI person thing that would kind of triage you. And like if you're really pissed off, then you can like override it. But maybe you could be like, maybe that'd be enough for you to be like, okay, let's ping you and get you into somebody else. Or it can sense the tone of your voice, it can sense all these things, and it can say, this one sounds urgent. I should get them in. Right? Like that's stuff that your doctor never is going to get a chance to do. But now your doctor's seeing all the stuff that's important or not seeing patients that are pissed off because they waited 6 months to see you.
Yeah.
Right. So like there are so many aspects of this that are good for the patients that don't require you not getting to see a doctor.
Yeah, and it's going back to some of the things that I'm privileged to kind of work with is you're talking about creating the correct agent and also learning what the correct prompt is and putting those things together to have these diagnoses that hopefully will conform to the needs of the patient and hit the warning signs for the doctor saying, hey, we've got to get these patients in.
Yeah. I think the thing I'll keep bringing up is AI. This is a good summary. AI is going to make healthcare hopefully faster. It's going to make it more efficient. It's hopefully going to make it more cost conscientious because you're not missing things, and it's going to make it way better experience for the patients because like they're going to get their MRI done and like you have AI MRI machine, so it's faster at calculating things, right? Like the new MRI machine we're looking at, it's got AI built into it, so it can do like double the scans in a day, right? So now you sign up for an MRI and you get your MRI in one day rather than waiting 3 months. Then it's interpreted faster because it's got AI, and then it's pinged to the radiologist that no longer has to look at like basic boring MRIs. It's got the ping, so it's like this one you should look at. So then the radiologist reviews the big ones, and then that's checked off. And now the radiologist is less stressed, so he can do it. And all of a sudden now you're like, okay, you've got all this stuff. You've got an ACL tear or whatever, you got something going on. So now we're going to ping you to the orthopedic surgeon. We're not going to send it to a person to do it. We're going to ping it right to the orthopedic surgeon's office and actually schedule you. Like you would be in like, I think that any American and a non-American, but American using the healthcare system would be absolutely elated to have that experience. So I think that you'll find that it'll miss less things because, like I said before, if we can remove all the frivolous stuff for our surgeons, doctors, they're going to be so much better at their jobs. And so I think that's what we're going to see is that you're going to see better healthcare for the patients. But I guess that's just my opinion. So we'll see.
It sounds like an episode that we will eventually update and kind of confirm.
Why he was so wrong and where we went wrong.
No, I think there's some great ideas, and especially it's a great understanding of how we're utilizing AI. Really, this is the infantile stages of where we are with this technology as we, our next, industrial revolution that's happening right before our eyes. So it's a very exciting time, and we'll see how it all shapes out. Dr. Garcia, congratulations on Top Doctor once again. That is one distinction that AI cannot take away, because you're doing it the right way. So I just wanted to shout you
Thank you.
out, and I know you've got some sun tanning to do. So we're going to
Yeah, I got
let
the
you
hat on. I'm
go and
ready to
ready to
go.
go. Got your sunblock ready?
I do. Well, the Brazilian skin helps a little bit, so I don't need too much on there.
Oh, baby. All right. Enough of that. Go do your hit and go enjoy yourself. Thanks for listening to Sports Doc Talk. We always want to hear from you. Please check out our website, sportsdoctalk.com. We've got shows, we've got great information, we've got links, we've got transcripts. I don't know what else, Dr. Garcia. What else are we missing from
We
that?
got social media. We got awesome guests. I mean, honestly, this is one of our first big topic shows in like a few months because we've had so many good guests,
Yeah.
and we have so many more coming.
Oh,
If you're listening, ping
we've
us
got a
with the
lineup.
talk. Ping us as a guest. We love to have the guests on. We have some really good ones coming up,
Yeah.
and we're not going to let it out. But we have some good ones coming up. That's all I'm going to say. And the
We've got
hot
a
topics have been
great
good. But this
lineup.
is the first big topic one in a while. Will, so this is
Yeah.
awesome because we just thought it was time. You guys, but again, there's a lot of good guests coming up. So stay in tune. Social media, you name it, and check us out.
Yep. We appreciate the viewers, the listeners, and all the support. We hope to continue to provide information. But as you said, we've got a lineup that's coming up in 2025 that's sure to be entertaining. Dr. Garcia, say goodbye.
Bye, guys.